With such a deep wound, Tom knows Rafa could have catastrophic internal bleeding.
I can't feel my fingers.
Henry suddenly seems confused, a worrying sign his brain is not working as it should.
Paul had been trying to repair some rotten wood on his house when the scaffold tower he was standing on gave way.
Ambulance service, is the patient breathing?
I don't know. It's just fell off the roof.
Okay, how old is the patient?
81.
Are you with him at the moment?
I'm with him. It's got a smack on his face, on his tummy.
Can you check if he's conscious and awake for me?
Are you awake, love? No, he's not answering.
Okay. Are you breathing in and out normally?
No, it's not.
I've got help coming to you as quick as they can, okay?
An ambulance has been dispatched, but with the possibilities of a fractured skull and internal bleeding, the advanced clinical expertise of critical care paramedic Colin is also urgently needed.
So we're going to an 81-year-old male who was fallen off a roof. I think it was reported that he was unconscious, so that's where we're heading at the minute. And it's very close, actually, so we might actually be on scene first. 6-2, go ahead.
Falling from height is the biggest cause of death for people tackling DIY. Every week, someone is killed falling off a ladder. Fortunately, the address is just minutes from base, and Colin is first on scene.
What's his name?
Henry.
Hello, Henry.
Hello.
All right, my name's Colin. Can you hear me all right?
Yep.
All right, do you remember falling off the roof?
I haven't fallen off the roof.
Where have you fallen, from the ladder? Do you know where you are? Just keep your head nice and still for a minute, and we'll see what's going on with you, all right? You've obviously fallen and hit your head quite hard.
Henry, a retired teacher, was checking for leaks on his roof when he fell onto the concrete drive. His wife Patsy was at home and called 999.
He put his foot on the first one and he slipped.
Okay.
A local ambulance crew has arrived to help.
So he is conscious, he's maintained his own airway, he's got a strong radial pulse. I think the plan will be is that we'll mobilise him on a scoop, get him up off the floor, and then we can give him assessment in the back of the ambulance.
As well as a significant head wound, Colin's also concerned Henry has suffered internal injuries. And any medication he's taking could make bleeding significantly worse.
Is he on any blood pills? No, not blood pills. He's on blood pressure tablets.
All right.
I've got his medicine.
We'll get everything for you.
What's your wife's name? Patsy. Patsy, he's okay. Okay, he's fully conscious. Just relax. Go and just calm yourself down, because we're going to look after him and he'll be fine. There's no need to rush around and get yourself all worked up. He's going to go to the hospital for a checkup and some assessment, but he'll be okay.
Colin must keep Patsy calm. He needs to concentrate on Henry's trauma.
What were you doing, Henry? What had you gone up the ladder for?
In Oldbury, critical care paramedic Colin Apps is treating 81-year-old Henry, who has a serious head injury after falling off his roof.
Am I on the roof?
You're on the floor at the moment, on your drive.
You can't fall any further, Henry.
Henry suddenly seems confused, a worrying sign his brain is not working as it should.
Okay. Ready, lift.
His brain may be swelling and pushing against his skull, reducing the vital flow of oxygen-rich blood.
So she's put the ladder away, but he was up at this top of the guttering bit, and it sounds like he's just missed his footing on the ladder and fallen. The ladder stayed where it was, and he just fell down to the floor. So quite a fall for his age.
Can I follow with my car off so I know where you're going? Assess your needs.
They won't let you in the hospital when we get there.
But how will I know where it is?
So what we'll do is we'll take your details, just next to it, and someone will call you from the hospital, okay?
Okay, come back.
COVID restrictions mean that Henry's wife Patsy can't go to hospital with him.
We just got him in the back of the ambulance. We're going to do a set of observations. He's obviously elderly, and he's had a decent fall, and he's lost consciousness, so that's a concern. He'll need to go to hospital with an alert so they can get him assessed and scanned, if possible, quickly if he needs it. It depends on his condition when he gets there. Just have a feel of his chest for me. Just have a feel all around this, because you check, I know you listen, just have a feel all around, just check for any fall. Does it hurt anywhere where we press on your chest?
As well as damage to his brain, Colin is concerned the impact of the fall may also have injured Henry's lungs.
Henry, do you have any pain in your tummy?
A blow to the chest can cause fluid to build up, which has life-threatening consequences.
And with your legs, can you move your legs for me? And that one. Can you feel me touching all the way down your legs? Yes.
Any pain in your chest at all?
Listen.
No, that's all right. You just look a bit red in the face.
After masking up, Patsy is allowed onto the ambulance to say goodbye, while Colin updates the trauma desk.
He's impacted the ground with the right side of his head, where he's got a large swelling and laceration above his eye and around his right zygoma. He also might have a broken nose. He's got no neck or back pain. He's got no chest pain. His chest all seems fine on examination. He's not 100% sure exactly what's happened.
To let you know we're going to stand.
Colin is happy Henry is stable enough to be left with the ambulance crew for the 10-minute journey to the nearest trauma centre.
They will assess his whole body. They'll make sure he's not got any injuries they haven't missed. They'll monitor his observations for a good while. They might even keep him in overnight. They might keep him in longer than that. He'll be in A&E initially, and then he'll probably be moved to a ward. So just try not to... As he is at the moment, he seems like he's recovering well. He should make a good recovery, how he seems at the moment, all right?
Thank you very much indeed for all your help.
All right, you take care.
Sorry about this.
No, you don't be sorry. We just hope he's all right, so all the best. His risk factor is his age, and that's why he's going to the trauma unit, where they can give him a rapid assessment to make sure that he's not going to deteriorate. You know, he's 81, he's fallen off a ladder. There's plenty of 20-year-olds that have fallen off ladders, so yeah, he's just got to be careful. But I should think he'll be able to get back to his DIY soon.
Ambulance service, is the patient breathing?
Yes, yes, but the person's on the floor.
Awake?
Yes, but the person has cut the belly.
Have they fallen? They've put themselves with a chainsaw. Are they able to speak to me?
No. Oh my God, everything's out.
His intestines?
Yeah.
Has he lost enough blood to fill 2 months?
Yes, a lot. Please, just come.
We're coming on blue lights and sirens, so we're going to be there as quickly as we can.
It looks like a 43-year-old male who has sustained an abdominal injury from a chainsaw, and his intestines are out on the floor.
An ambulance is already on scene, but the man's injuries are so severe that they've requested critical care backup. Tom has been dispatched.
It's easy to paint a picture, but you really don't know until you get there.
11 minutes after receiving the call, Tom arrives at the address. His body cam records every detail of the horrific scene.
Hi, you're right. Hello, sir. My name's Tom from the air ambulance. What's your name?
The injured man, 43-year-old forklift driver Rafa, is being given oxygen by the ambulance crew to try and keep him conscious as his body reacts to the shock of the 5-inch wound to his lower abdomen.
Right, so with this, if you just want to cover that with that. Perfect.
I'm just taking a photo of it.
No, that's fine.
Just in case you want.
Right then.
It looks like it's adipose tissue more
Yeah.
than anything, doesn't it?
The blade has sliced down through skin and flesh, exposing his intestines.
Oh.
Tom needs to try and keep the wound clean, prevent his intestines coming out, and stop the bleeding.
Hopefully, if we can just hold it around it, it will stick to it a little bit. And then, if I can get you guys to put some tape around that, is that all right?
Just going to stick the dressing down, Raphael, okay, just to keep it clean.
Okay, so this gentleman, age, I believe you already know. He's a GCS of 15 at the moment with isolated abdominal injury with partly eviscerated bowel.
With such a deep wound, Tom knows Rafa could have catastrophic internal bleeding. He needs to get him to hospital fast for emergency surgery.
I think my initial plan would be to get some IV access, wound management, and then convey him to the QE.
The danger is that moving him may put too much strain on him and send him into cardiac arrest.
How are you feeling? Sam, can you get some IV excess? Is that all right? We're going to cut this off.
It isn't safe to move Rafa until Tom knows the full extent of his injuries.
Just put him forward. I just want to check his back while we're here. Yeah. It's very sweaty, isn't it? OK, so no other injuries. Was this done on a chainsaw?
Yes.
Can you find out exactly what's happened?
The gentleman there speaks English.
How are you feeling?
He went on the ladder. He was doing something around this thing.
Yeah.
And, yeah.
It turns out Rafa was fixing the guttering with an electric saw.
This one?
Yeah.
When the ladder slipped, the saw ripped through his abdomen.
Yeah, 6'2", just an update. So heart rate's around 50 at the moment.
Rafa's blood pressure is low, which could be a sign that the blade has damaged some large blood vessels internally or even perforated the bowel.
He's quite clammy and sweaty at the moment. I see no immediate signs of him hemorrhaging, however, I don't know how deep it is.
They have to get him to hospital.
I'm going to get him in the back of the ambulance and convey QE. I'll put some details as we go. OK then, Rafa, we're going to put our chair here. We're going to get you to move you and take you into the back of the ambulance, OK? My only concern is he's a bit hypotensive, so he might go a bit funny if we stand up. So we're trying, obviously, avoid as little movement as possible. Hold on to my hand. OK. Do you feel like you can walk? No. OK, that's great. Are you sure? OK.
Despite Rafa's horrific injuries, Tom has no choice but to move him onto the ambulance.
Yeah.
Keeping the pressure on the wound to stop his intestines spilling out.
I'm just a bit worried he's a bit hypotensive, so we'll just take our time. Well done. OK, so up you come. So, at the moment, this gentleman's got a circular saw accident to his stomach, part of his bowel, and a lot of his stomach is out at the moment, so we've dressed it. I'm going to give him some drugs to stop him bleeding and pain relief and take him to the major trauma hospital in Birmingham.
Just going to give you some pain relief, some paracetamol, OK, to help with your pain, Rafa.
How are you feeling? Yeah?
They head to the major trauma centre at the Queen Elizabeth Hospital, where Rafa will need immediate surgery to repair the wound and stop any internal bleeding.
Rafa, are you all right holding that?
On the journey, Tom needs to keep his patient under close observation. There's a real danger his low blood pressure could suddenly drop, putting him into cardiac arrest.
Rafa, how are you feeling? All right? Good. Well done. You're doing a great job. We're nearly there.
Arriving at hospital 23 minutes later, Tom can hand over his critically injured but now stable patient to the waiting specialists.
Thank you.
Ambulance service. Is the patient breathing?
Can't see any at the moment.
Is he breathing?
His arm. Has he disappeared?
Sweetheart, is he breathing?
Yes, at the moment, yes.
What's happened?
What?
What's happened?
Oh, he tried to get up the roof, onto the roof, and the ladder fell.
And he's fallen off a ladder?
Yes. He's hit his head.
And he landed on his head?
He's actually landed on his head and his arm.
OK, we're coming as quick as we can, OK?
All it says on the notes, falling from the top of the ladder from the height of the guttering on a house, but is conscious at the moment, complaining of head pain and unable to feel or move an arm.
6'2", en route.
A fall from height, resulting in head trauma, has the potential to leave a patient with life-changing injuries.
55-year-old male, can't feel one arm, nausea and dizzy, in the back garden, and he's landed on concrete.
An ambulance has been dispatched, and the advanced critical care skills of Richard and Alistair are also urgently needed.
So 55 is where we're starting to have some concerns with age, but the injury, there's big potential if he's fallen on concrete. He's already reported as having a head injury, so again, there's potential for that to develop and become far worse quite quickly. We're obviously going to have some concern over his spine with that height of fall, so he's likely to end up immobilised and then conveyed to hospital, where he really needs CT scans to see what damage he's got underlying.
When Richard and Alistair arrive, the ambulance crew are treating the man. Retired glazier John was fixing the guttering on his house when he fell onto concrete, hitting his head and arm in the fall. With the potential for spinal injury and head trauma, John needs urgent treatment.
Let's look at some pain relief in a bit, okay? Sharp scratch now, all right?
We managed to get a blood pressure on him, yes or no? No, all right. I would say that lower arm is slightly deformed, isn't it, I think?
You see okay? Don't look around, don't move your head, just have a look around. Yeah? Any blurred vision or anything?
You'd start off with
Before giving John any specialist pain relief, Alistair wants to establish whether a medical condition could have caused the fall.
And do you remember falling off this ladder? Yeah, that's all right. Just trying to rule out you having a medical event, basically, like somebody going dizzy or something.
Alistair now needs to be certain there are no life-threatening injuries, so checks to see if he has any abnormal sensation or movement that would indicate a spinal injury.
I can't feel my fingers.
Yeah, that's fine.
Can you feel that? Yeah.
Can you squeeze or not? No, you can't. Oh, that's okay.
John, remember, mate, try and keep the head as still as you can for us, okay?
Can't help it.
Oh no, mate. But just try and keep it as still as you can, all right? Now lifting it up, because as well as that arm, you've got a bit of an head injury as well, and you've come from some height as well, haven't you?
Having assessed John, Alistair can now start to get his pain under control.
Right. Have some more.
We're going to get you some pain relief now, buddy, okay?
Well, let's give him at least 5 over a couple of minutes. So do a couple and then another couple more. So it's probably going to take quite a bit of morphine to get on top of this, isn't it?
The critical care team must get John to hospital for an urgent CT scan of his head and arm. But despite the morphine and paracetamol,
Just going to straighten your arm, my friend, I'm sorry.
John is still in too much pain to be moved.
Okay. All right. No. Morphine.
As well as a likely broken arm, John also had a head injury. Alistair and Rich want to get him to hospital where he can be scanned. First, though, they need to get his pain under control.
How's your pain doing? Have we got on top of it or not, or is it still hurting? Okay. All right. Okay. Scale of 1 to 10, what is it? 0's nothing, 10's agony. Where are you? 10 at the moment. Okay.
Even after multiple doses of painkillers, including morphine and Entonox, John is still in agony.
Okay, I might do something a bit strong, mate. He's had 10 of morphine, 1 of paracetamol, and we're still at a pain score of 9.
It's going to take a bit of time for the
morph
to
I'm just
kick in,
thinking a little squidge of something stronger like ket wouldn't actually hurt, would it? So, John, I'm going to give you some ketamine in a second, which is quite a strong drug. And then I'm going to give you a small amount, just enough for us to be able to move you, hopefully without you knowing what's going on.
Although it's a highly effective painkiller, ketamine can also have side effects, including hallucinations. So Rich warns John's anxious family, who are watching on.
So it looks like it's just his arm at the moment. He's talking to us and communicating normally, so that's a good sign. Going to give him some ketamine.
Try. Do you want to hold that over his face? Nice deep breaths for a minute, John.
Deep breath, John.
Deep breaths.
Just like that. Brilliant.
That's all right. That's the drugs that we've given to you. Just going to roll you over in a second, John, and get you off to hospital. So let's start working around, getting a scoop in.
With the ketamine taking effect, Alistair and Rich prepare to move John onto the scoop.
All right, John.
Ah!
All right.
Ah!
So I've got hold of his waist, I've got hold of his upper arm here.
Oh, man.
That's in. Okay.
I felt that.
You felt that, did you?
When the ketamine wears off, John will remember the fall, but not the pain.
What's going on?
They're just popping you on a stretcher, John. You're all right with a strap. You're all right.
Stop it.
How are we then, everybody?
We're going head first.
Head first.
Just watch those slabs because they're wobbly.
Okay, all right. Everybody happy with the backs? Yeah. Okay. Right. Ready, steady. Lift.
In case there are any side effects from the ketamine, the critical care team will continue to monitor John on the journey to hospital. He will need an X-ray to check for any broken bones and a CT scan to assess his head injury.
This is my house.
It is your house. Watch the elbow. Yeah, I've got it.
Ambulance services, the patient breathing?
Yes, he's breathing. He's fell off some scaffolding.
Okay, how old is the patient?
He's 74. He's gone very pale.
Okay. The emergency ambulance has been arranged.
Back injuries are among the most common major traumas and can be life-changing. It's estimated that every 4 hours someone in the UK is paralysed from damage to their spine. With a chance he could be seriously injured, critical care paramedics Stephen Mitchell and clinical team mentor Ben Reen are dispatched.
We are going to a 74-year-old who has fallen off some scaffolding boards, approximately 12 foot height, and apparently landed flat on his back. He's complaining of back pain and arm pain. So the risk is that he's got a spinal injury, really. His age brings something into that as well. Any pre-existing medical conditions like osteoporosis, brittle bones, they make a big difference.
Ben and Mitch are first on scene and find the man in his front garden.
Hi there.
What's your name, sir?
Paul.
Paul. I'm Steve and this is Ben. How old are you, if you don't mind me asking?
74.
74.
Paul had been trying to repair some rotten wood on his house when the scaffold tower he was standing on gave way.
You look like you're in a bit of pain there.
Yeah. I've got a nasty gash on my finger.
Yeah. And where's the majority of pain?
Across my back and in the hip.
And with regards to the pain in your hip, is it on the same side as your back? Or is it the other side?
Left side.
Left hip, OK. We'll just go and have a quick look at your back and left, OK.
Whilst we're doing that, can you tell us what happened?
Yeah. I was on the platform up there.
Stood up?
Yeah. Stabilisers it all out. And for some unknown reason, it just started to go that way.
Yeah.
Twisted around, and I fell onto that bar on the dock.
Were you knocked out at all?
No, luckily.
Good.
Yeah.
Saves that.
Bloody hell. No,
All right, pop your blood pressure cuff on there.
Where possible, the advice after a fall like Paul's is to stay still, because moving can cause injuries to worsen.
The reason I got up was because they were worried these plants might fall off on me.
OK, gotcha.
Fearful of the scaffold boards falling, Paul's wife and some nearby workmen moved him to safety.
When they assisted you up, did you move anything by his own means, or...?
Not a lot, no.
No, OK.
Mitch and Ben decide to leave him sitting.
You're fine as you are. We'll work around you.
OK.
All right.
Are you short of breath at all?
No, it's painful to breathe in.
Just painful, OK. You might have done something with your ribs at the back. Can you try and push down on your leg as if you're going to get up, but I don't want you to get up like that, OK. Right, we'll get you a little bit of oxygen and I'll just go and get some painkillers out of the car, OK?
Thank you.
All right.
The pain in Paul's chest points to a fractured rib.
Pop this on.
Is he normally quite a pale complexion?
Yeah, he's pale, but he's got
Yeah.
his paler than normal.
Mitch calls the control room to request an ambulance.
Could do with an ambulance. Patient's got shortness of breath from pain, along ribs.
A spinal injury also can't be ruled out.
Would you like that as a red or an amber backup, over?
I'd probably put it as a red. What were you trying to do then?
All the wood's rotten. I was going to replace that.
Yeah.
and then paint the house.
Paul is in a lot of pain. He needs a scan to determine whether he has broken any ribs and to make sure he hasn't damaged his spine.
Did you want to do cannula and stuff like that? Yeah, it's sound.
While they wait for an ambulance, Ben and Mitch are doing everything they can to make him more comfortable.
This arm's not sore, is it?
No,
all right.
Only below the elbow.
I'm going to pop a needle in one of these veins and we'll get some pain relief in, all right?
Okay.
All right, little scratch coming up, okay?
Yeah.
Ben inserts a cannula into Paul's arm so that painkillers can be administered straight into the blood.
Are you allergic to anything at all?
No.
Have you had any paracetamol at all?
No.
Okay. It's paracetamol.
Lovely. Thank you.
Feel that go in.
Although it's just paracetamol, it works really well, actually, through the vein.
Yeah.
It should be a bit quicker for you.
Out of 10, how bad would you say the pain is? 10 being really bad.
Oh, no.
Pardon?
About 7.
Although Paul's putting a brave face on it, he's still in agony.
Ever had morphine before?
No.
No.
Morphine sulfate, 10 milligrams 1 ml, 223.
Is that easing off a little bit there?
Yeah. No, it's only when I pass it up, I'll get the time.
Okay.
Finally, the pain is beginning to subside.
We're just waiting on the ambulance now, all right?
Yeah.
Paul will be taken to the nearest hospital, where he'll be x-rayed to find out exactly what damage he's done.
Hiya.
I don't think he's going to be able to move too far, so I think if we bring the stretcher light right up next to him, start there a sec, I think come back a bit, that's it.
You all right
Yeah,
there?
perfect.
As they are confident his injury doesn't involve the spinal cord, Ben and Mitch help Paul to get himself onto the stretcher.
Brilliant work. Well done, Paul. So your head goes that end,
Going up this way. Yeah.
and then we'll bring your
Hold
feet
your
up.
back if you've got the legs.
Okay. Keep your feet together, keep your feet together, that's it.
Will he have to stay in?
We don't know. It's completely up to the doctors and what they see and what they find.
Just a bump now while we go up the ramp. Okay.
He was clearly in a lot of pain and he may have some rib fractures. Hopefully he hasn't done anything to his lung or anything underneath. We'll see.
Ambulance service, is the patient breathing?
Paul, is he breathing? No, we don't think so, no. Currently performing CPR.
And how old is the patient?
Late 50s.
Okay.
Come on, Andrew. Come on, mate.
Keep going with those chest compressions, hard and fast, okay?
Okay, thank
With them
you.
in as quickly as we can.
999 mode activated.
Fewer than 1 in 10 people who suffer an out-of-hospital cardiac arrest survive. 2 ambulances are already en route, but the advanced life-saving skills of the critical care team have also been requested. Critical care paramedic Tom Waters and paramedic Ross Layton are immediately dispatched.
There's 2 crews and an OM en route. Looks like the first crew are probably 2 minutes away, so I'll keep an eye on it.
Cheers, Bert. Thanks.
Thank you. Coming through the 50-50-year-old male.
Did you say CPR in progress?
Yeah, that's right.
Cheers.
Take first exit.
So we're going to a what sounds like a 50-year-old male at a industrial unit in cardiac arrest. There's CPR ongoing, and there's ourselves going and another ambulance, as well as the ops manager, but at the moment it's potentially a witness to cardiac arrest.
For every minute that his heart isn't beating, the brain is being deprived of oxygen, causing irreversible damage. The man's work colleagues have been attempting to restart his heart with chest compressions, giving him the best chance of survival. Arriving on scene 6 minutes later, the patient is still outside on the ground, now being treated by the ambulance crews.
Of
course, he's breathing at a normal respirate, just trying to get some IV access.
Perfect. Okay, yeah, that's great. Hello, sir. Open your eyes for us. And was it just one shot from you guys? Just one shot. One shot.
Forklift driver Andy was leaving work with 2 colleagues when he collapsed. When the ambulance crew arrived, they were able to use a defibrillator to shock his heart back into a working rhythm.
Yeah, get blood pressure and saturate.
Andy is now breathing, but Tom and Ross need to monitor his heart rate and oxygen levels closely to make sure his blood is circulating properly.
You're happy just kind of get him all blocked away. Ross, I just want you to keep an eye on his knobs and stuff like that, and we'll just manage him from there.
When he fell over as well, apparently he banged his head on the floor.
OK, thanks for telling us. Right then, let's get this under him.
Andy's in a very vulnerable state. Tom knows the best chance of saving their patient is to get him to a hospital that specialises in cardiac care.
OK, yeah, when you're ready, you're right to just go on his shoulders a little bit. On 3, 1, 2, 3, roll. And then towards me a bit. That's it, perfect. Yeah, that'll do. And then stay where you guys are, and we'll just do the other way around.
With the help of the ambulance crew, they manoeuvre Andy onto the scoop stretcher.
OK, so just going to roll on 3. 1, 2, 3, roll. Perfect, and back down. So clipped in at the front, just got to do the feet. Keep the BVM there. No, it is a bit. It was 190, so it's 150. He's got good pulses, so he doesn't need anything. Good. Yep.
The ambulance crew have IV access in case they need to administer emergency drugs to try and restart Andy's heart en route. He could arrest again at any moment.
So the only thing I want to tell you before we move in, if he goes back into cardiac arrest, we can do 3 consensual shocks. Yeah, let's go. We've got a 50-year-old male. He's had a witnessed cardiac arrest at an industrial site. He's currently had 1 episode of VF where he's been shocked and rosked. So he's in an SVT at the moment at a rate of about 170. He's self-ventilating, GCS of 3. He's maintaining his own airwaves and O2.
They need to get Andy to Birmingham City Hospital Specialist Cardiac Unit for urgent treatment. But before they set off, Tom radios control with an update.
I haven't done a 12 lead, but it looks like he's got some inverted T's, so he's probably having an evolving MI. And we're going to go now. Cheers, bye, bye.
Tom thinks Andy is suffering from a myocardial infarction, commonly known as a heart attack, where the supply of blood to the heart is suddenly blocked. It needs to be unblocked in an operating theatre to prevent permanent damage to the heart muscle.
Breathing-wise, self-ventilating. Rapid rates. OK, and circulation, just feel for a radial pulse for me.
Yeah, I've got a radial. I've got blood pressure on here, 163 over 106. Sats of 85. D, still GCS 3. Temper BM en route.
The ambulance crew used a defibrillator to shock his heart back into a workable rhythm. It is now beating fast and erratically.
I think the only issue is his sats aren't great, is it? No. So we'll put him on the Mapleson.
Yep.
And then I'll get you to just go by his head, if that's all right, Ross. And you can manage his airway from the top there.
Because his circulation stopped, the oxygen saturation levels in Andy's blood have dropped to 85, worryingly low. The best hope they have of keeping him stable on the journey is to maintain his breathing using an oxygen delivery system.
So when you're ready, we can start making our way nice and slowly. So heater on, put some blankets around him. If you just get the mask out of that, perfect, buddy. Yeah, here we go. The only thing we can really correct here is sats are a bit rubbish. Jacob, can you repeat the blood pressure for me, please?
It's an 11-minute journey to the hospital.
So, how's that sats reading as one side?
85, but with a poor trace as well, mine.
To manage Andy's vital airways, Ross wears level 3 PPE.
So just jaw thrust, mask. Perfect, okay, good. Let's see if we can get a better trace on that sats probe.
As oxygen is pumped through the mask.
And blood pressure's reading. Got an access. 160. He's relatively flat, so I don't think he's going to need sedating or anything like that at the moment. The main thing just to keep an eye on is just trismus. So if he does lose his airway, then we'll do something about it. But in the meantime, we'll just leave it as it.
Even though Andy is barely conscious, there's an acute danger he may become agitated and clench his jaw, which could jeopardise his breathing.
Hold my hand for us. Give us a squeeze. So Sat's now up to 87, end tidal at 2.2 but nasal, and his heart rate's gone down to 1. Well, it's quite erratic, but it was 120 just then. So, and just have a quick.
Breathing quite hard against his bag.
Okay, that's fine. Don't worry. He's shifting quite well, isn't he?
4 minutes into the journey, and he starts to show signs of fighting the breathing system.
He's biting on down on this. It looked quite.
Okay, just get it in. Do you need a bit of midazolam to lighten it up?
Yeah.
Is his jaw still a bit tight?
Yeah. He's starting to get a bit agitated here.
That's all right.
Well.
We'll use your hand, mate, if that's all right.
Yeah, he's probably fighting it.
Okay.
Midazolam is a sedative that will make managing Andy's airway easier. Tom administers a small dose through the cannula.
93 Sats. Rate of 126, so it's come down a bit. We're here now. 95 Sats, that's good.
Arriving at hospital, Andy's oxygen levels are finally showing signs of improvement.
So, Ross, are you happy at the moment, or are you just...
happier?
Good, okay. So oxygen levels, airway-wise, we're working on it. Breathing, we've got Sats at 94% now. We've got a heart rate of 120, so it's come down nicely, and he's got good radial pulse. He's had 5 of the midazolam. He's got O2. That's running, okay. So we're all happy. Happy to go?
Stand by.
Just move out slowly.
Andy is handed over to the specialist cardiac team. His chances of survival greatly increased by the quick-thinking actions of his colleagues.